So this is our Clinic in a Bag platform. It basically is a way for clinicians and medical professionals to perform comprehensive medical exams at any point of care. This is the form factor of the bag, but it can also be on the wall. We're working on that. It can also be as part of a cart. So this bag involves everything, the whole infrastructure that a medical professional would need to make comprehensive medical exams. So we have a blood pressure cuff, okay? We have a peak flow. We have, in here, we have a pulse oximeter. We have a thermometer. And then we have our cardio sleeve device to do comprehensive heart screening. There's a Holter. We have a weight scale. We have a camera to look at the ear, nose, and throat. We have an ultrasound, and of course the iPad, and we have 12 lead ECG along with some accessories. Okay. Again, this would allow the medical professional to get a very good profile of the patient's health at any point of care, so that then a medical professional as part of the care team can actually get actionable information so that they can make diagnostic decisions about that particular patient. So all these tools then interface with a mobile application. Okay, this mobile application then connects with all of these different tools. Okay, that particular mobile application, okay, I'm going to log out of it. So I'm going to start from the top. Okay, so this mobile application is installed on an iOS device where you log in. Once the medical professional logs into the application, they get to see a preloaded patient list, or they can go in and actually add patients on demand. Okay, those patients on there, for selecting a particular patient, the person administering the exam can actually scroll and pick a patient, or they can search for a particular patient's first name or last name, or they can search for a particular patient's first name or last name. So once they pick a patient, so they have a number of exam options that can be administered for that particular patient. For example, so what you see here, you see vitals, you see heart sound auscultation for murmur. They can check the patient's heart rhythm. They can get an indication for the pump of the heart to see if the patient may have heart failure issues. They can check for the lungs, check for lung function such as COPD and asthma. They can do some high-level labs, right? They can check for the blood glucose. They can check the person's urine, about 10 different parameters that can be checked in the urine, such as the glucose in the urine. They can check for proteins in the urine, et cetera. And then finally, they can check the lipid panel. They can check the patient's cholesterol, total cholesterol, bad cholesterol, good cholesterol, triglyceride, to get a sense for what's happening inside the pipes as it relates to cardiovascular health for that patient. In visual exam, they can take pictures. They allow a clinician to actually take a look inside maybe the ear or inside the mouth or inside the nose to see any sort of abnormal issues that may be happening within these places. And the clinician can visually then inspect those sections of the patient's body and then make a diagnostic decision. Again, the key here is to provide the clinician with whatever he or she may need so that that clinician can make a diagnostic decision for that patient.